Hi, I'm Andrea, and this presentation on cerebral palsy was developed for Leah and Jung's EDS 522 class of Working with Families at the University of Kentucky. What is cerebral palsy? Cerebral palsy, also known as CP, is characterized as a group of chronic conditions that affect body movement and muscle coordination. It is not a problem with one's muscles or nerves, but faulty development or damage to the motor areas of the brain. CP disrupts the brain's ability to adequately control movement and posture. Cerebral refers to the brain and palsy to muscle weakness or poor control. Cerebral palsy itself is not progressive because the brain damage does not get worse. However, secondary conditions such as muscle spasticity can develop, which may get better over time, get worse, or remain the same. CP is not communicable. It is not a disease and should not be referred to as such. It is not curable. However, training and therapy can help improve function. Physical characteristics of CP include the inability to fully control motor function. Depending on which area of the brain has been damaged, one or more of the following may occur: muscle tightness or spasticity, involuntary movement, disturbance in gait or mobility, difficulty in swallowing, and problems with speech. In addition, the following may occur: abnormal sensations and perception, impairment of sight, hearing, or speech, seizures, and/or mental retardation. Other problems that may arise are difficulties in feeding, bladder and bowel control, problems with breathing because of postural difficulties, skin disorders because of pressure sores, and learning disabilities. Next, I'd like to address the incidence and prevalence of CP. It is estimated that 2 out of every 1,000 newborn children will develop it. 10,000 babies and infants are diagnosed each year. 40% born with CP will have a severe case, and it is the most common motor disorder in children. It is second to autism as the most common disability in children. 1 in 278 children have cerebral palsy. Spastic cerebral palsy is a form of cerebral palsy which affects 70 to 80% of patients. The muscles are stiffly and permanently contracted. In some cases, spastic cerebral palsy follows a period of poor muscle tone in young infants. Doctors will often describe which type of spastic cerebral palsy a patient has based on which limbs are affected. The names given to these types combine a Latin description of the affected limb with the term plegia or paralysis, meaning paralyzed or weak. By looking at this diagram, one can see that a child is hemiplegic if their arm and leg on one side is affected. It is paraplegic if only both legs are affected, and diplegic with slight involvement elsewhere. If both arms and both legs are affected, it is considered quadriplegic. Athetoid CP is a form of cerebral palsy that is characterized by uncontrolled, slow, withering movements. These abnormal movements usually affect the hands, feet, arms, or legs, and in some cases, the muscles of the face and tongue, causing grimacing and drooling. These movements often increase during periods of emotional stress and disappear during sleep. This type of CP affects 10 to 20% of patients. Another form of CP is ataxic cerebral palsy, affecting only about 5 to 10% of patients. This type affects one's sense of balance and depth perception. Affected persons often have poor coordination, walk unsteadily with wide-based gait, place their feet unusually far apart, and experience difficulty when attempting quick or precise movements, such as writing or buttoning a shirt. One may also get intention tremor that worsens in the affected area as they try to get closer to a desired object. This diagram shows the different types of cerebral palsy and where they are affected in the brain. It is not unusual for patients to have symptoms of more than one of the previous three forms. The most common mixed forms include spasticity and atheroid movement. Other combinations are also possible. When diagnosing a child with CP, it is typical to see early signs before 18 months. Infants are slow to reach developmental milestones such as learning to roll over, sit, crawl, smile, or walk. Some have abnormal muscle tone, unusual posture, or favor one side of their body. Physicians test infants' reflexes such as the Moreau reflex and look for early development of hand preference. Babies don't normally show hand preference during the first 12 months of their life, but infants with spastic hemiplegia develop much earlier since the hand on the unaffected side is stronger and more useful. Doctors must rule out other disorders that cause movement problems. They can use CT scans to learn more about possible causes. They can use an MRI to give pictures of structures or abnormal areas located near the bone, or an ultrasound. This is used in infants before the bones in the skull harden and close. It is less precise than a CT and MRI scan, but it can detect cysts and structures of the brain. It is less expensive and does not require long periods of immobility. Next, I will discuss the causes and origin of CP. An English surgeon in the 1860s, William Little, believed CP was caused from a lack of oxygen during birth. In 1897, Sigmund Freud noted other problems children with CP had, suggesting it might have been caused earlier in life in the womb. In the 1980s, the government did a study of 35,000 births and found complications account for less than 10% of all cases. In most cases, no factors could be found. We do know that with congenital CP, results from brain injury during intrauterine life are responsible for about 70% of children with CP. An additional 20% with congenital CP are due to injury during the birthing process. In the United States, about 10% of children who have CP acquire the disorder after birth. Acquired cerebral palsy results from brain damage in the first few months or years of life and can follow brain infections such as bacterial meningitis or viral encephalitis, or the results of a head injury, most often from a motor vehicle accident, a fall, or child abuse. There are factors that can injure the brain and may produce cerebral palsy. These are risk factors, not causes, but an increase of occurrence. These include premature birth, low birth weight, inability of placenta to provide the developing fetus with oxygen and nutrients, lack of growth factors during uterine life, Rh or ABO blood type incompatibilities between mother and infant. Other factors include infection of mother with German measles or other viral diseases in early pregnancy, bacterial infection of the mother, fetus or infant that directly or indirectly attack the infant's central nervous system, prolonged loss of oxygen during the birthing process, and severe jaundice shortly after birth. Lastly, I would like to provide some resources and their websites for families with CP.